Before this change, the guidance was pretty straightforward. The COVID-19 vaccines were approved for everyone 6 months and older. But now the Food and Drug Administration is imposing some new restrictions. The new shots from Pfizer, Moderna, and Novavax are now only licensed for seniors 65 and older and for others with at least one high-risk health condition, such as cancer, asthma, or obesity. The Food and Drug Administration also revoked the emergency use authorization of certain COVID vaccines, making the Pfizer shot no longer available for children under 5. So what does all this mean for the vaccine's availability during this upcoming virus season? To get some answers, we reached out to this trio of medical experts from Johns Hopkins University, the University of North Carolina Health, and Emory University. They emphasize there are still a lot of open questions here.
Providers, insurers, pharmacists, parents, all of us, we're kind of in the dark.
For example, they say it's still unclear whether a patient with an underlying condition will be required to show proof to get the shot.
Most people don't get their vaccines at their doctor's office. They get it at a pharmacy or even their grocery store. And then we put those people in the awkward position of deciding whether somebody meets the criteria.
As for those who are young and healthy, the Department of Health and Human Services says that they will still have access to the vaccines, but only after a, quote, consultation with their healthcare provider. But our experts say that these young, healthy patients will likely need a prescription for what's called an off-label use.
What that means is that you couldn't get a vaccine at a pharmacy.
If you can find someone who would give you the chance to have the vaccine, if that's your choice, you may or may not have access to it through your insurance. And so you may be paying for it out of pocket.
White House Press Secretary Caroline Leavitt pushing back on concerns that this will put up barriers on getting the vaccine.
The FDA's decision does not affect the availability of COVID vaccines for Americans who want them. We believe in individual choice.
And soon enough, we'll be getting more clarity on what this new system will look like. CVS Pharmacy telling Spectrum News that they're expecting to receive the new COVID-19 vaccines in the coming days. Reporting here in Washington, I'm Evan Koslof, Spectrum News.